Waters view, PNS view, paranasal sinus view, occipitomental view. Welcome back to my channel. So join me as we explore its significance, applications, benefits in diagnosing dental conditions. Let's take a closer look. So Waters view, before we begin to anything else, first of all, the very important, how you're going to identify the X-ray, that if it is Waters view or not. Just look into the picture. I'm going to tell you certain tricks how you're going to identify. So understand. You will see two big circles. Okay, this is a trick. And two small circles or a heart. Two big circles and an incomplete heart. Okay, so this is you're going to identify. This is Waters view. सबसे पहले पहचानना आना चाहिए. Okay, now Waters view, also called as paranasal sinus view, PNS view and occipitomental view. Okay, so in this Waters view, we cannot see sphenoidal air sinus. Sphenoidal air sinus cannot be seen. In this view, we are able to see all the sinuses except the sphenoidal air sinuses. But with certain modifications like opening of the mouth, we can see sphenoidal air sinus also. So now let's see what are the sinuses that we see. We can see frontal sinus, we can see maxillary sinus, ethmoidal air sinuses. These sinuses are visible. Only one sinus, that is sphenoidal sinus, which was earlier not visible, or it is not visible, but with modifications like opening of the mouth, we can see sphenoidal air sinuses also. Okay, now let's see the sinuses in the picture, how you're going to identify. This triangular area, this is the maxillary sinus. Okay, these small inverted heart or the half heart structure, this is frontal sinus. Okay, now let's understand CM line at 35 degrees to the receptor. What is CM line? It is Canthomeatal line. And before I begin, let me explain you what is Canthomeatal line. It is a line that runs from outer canthus of the eye to the meatus, to the auditory meatus. So the line runs from outer canthus of the eye to the auditory meatus. So this is the line, and this is the same line we'll be talking about in the entire radiology. So in Waters view, CM line is 37 degrees to the receptor. It is a neat question also. So Canthomeatal line is at 37 degrees to the receptor. Now let's understand what are the indications of Waters view. It is done to evaluate maxillary fracture, zygoma fracture, orbital fracture and nasal fracture. Why we evaluate only these fractures? Let me tell you. Here the maxillary bone is visible. This is the maxillary bone. So you can able to see if there will be any maxillary bone fracture. You can see zygoma fracture. You are able to see orbits. So orbital fracture is also visible, and this is anterior nasal spine. So you will be able to see nasal fracture also. Okay. Now in exam also and in viva also, examiner asks what are the Macgregor and Campbell lines and what are Dolan's elephant lines. Okay, so let me tell you first of all why these lines are drawn. So these lines are drawn to evaluate the exact areas of maxillary fracture, and these lines are drawn on Waters view. Very important. Since you are studying these lines in Waters view, so this is by default, these lines are drawn in on Waters view only. So there are basically 5 lines. Okay, so this is the line number 1, this is line number 2, this is line number 3, this is line number 4, and this is line number 5. Now you have to learn it. Where the first line runs, it runs across the frontal sinuses. Okay, it runs across the frontal sinuses. Now the second line, it runs across the zygomatic bone. See, this is the zygomatic bone. Okay, covering the nasal cavity. This is the nasal cavity it is covering. Okay, now third line, it runs across the maxillary sinuses. So it is running across the maxillary sinus. This is the third line. Fourth line, it passes through the occlusal surface. So these are the teeth, and it is passing just above it, means just above the occlusal surface. Now fifth line is also called Trampnel lines. This is asked in NEET as well as in Viva. You must know. This is called Trampnel lines also. Trampnel line. Okay, you must know it. It is drawn on the lower border of mandible, passing from one angle of the mandible to the other angle. Okay. Now the second line, that is Dolan's elephant line. This is also very important, and these lines are also drawn on water's view. Okay, why it is called Dolan's elephant line? Because when you draw these lines on water view, it forms the face of the elephant. That is why it is called elephant lines. So it is also 3 line, first line, second line, and third line. So as you can see, this is the first line. First line is called orbital line, second line is called zygomatic line, and third line is called maxillary line. Now let's see one by one from where these line passes. It runs at the base of the orbit. As you can see, at the base of the orbit it is running. Okay, zygomatic line, it is formed from the zygomatic area. So this is the zygomatic area. It is formed from the zygomatic area. Third line is maxillary line. It lines the inferior border of maxillary sinus. It basically lines the inferior border of maxillary sinus. So this is how it is going. It is giving the shape of the elephant. So that's it. So this is the only amount of the content that you are supposed to know about the water's view, and you can write as it is if it comes in an exam about the water's view. This topic is very important for the point of view of Viva as well as NEET. A lot of MCQs are formed from this section. So I hope water's view is clear and you are able to tell about the Macgregor and Campbell lines, about the Dolan's elephant lines. Okay, so that's it. Thank you so much.